So hello friends, today I am going to demonstrate you the different type of uterine manipulator, and uterine manipulators are very important instrument for the gynecologist. Whenever you perform any gynae surgery, you need to know the uterine manipulator properly, and if you don't know how to use uterine manipulator properly, you will struggle. And there are different type of uterine manipulator available in the markets, and I am going to demonstrate you all the types. Now the uterine manipulator are of two type. One is a spring type, another is lever type of uterine manipulator. In a spring type of uterine manipulator, you have one handle, and once you rotate it to the clockwise, there will be antiversion, and you will rotate anti-clockwise, it will be retroversion. And this spring type of uterine manipulator or lever type of uterine manipulator, in any uterine manipulator there are three parts. One is tip, this is tip, another is shaft, and third is handle. Now these tips are changeable according to the size of uterus. You can use different type of the tip you can apply. Like if the patient has nulliparous uterus, you can apply this tip, and according to the size it should be little smaller than the cavity size, so that the pressure should be on the cervix and it should not perforate the uterus. So this tip, first you will put a sound and you will measure the cavity side of the, and then accordingly you will select the tip. And suppose the uterus is little large, then you can change it, you can remove the tip and you can attach and you can apply the another tip. So this is the other tip, and you can attach the little bigger tip for the bulky uterus, or very big uterus you have further bigger tips. So this is tip of the uterine manipulator which enter into the uterus, and cervix will rest here, and this is the shaft. Half of the shaft of the uterine manipulator is generally inside the vagina, half will be outside, and this is handle. And now this handle you will hold it like that, like a grip, and when you rotate it to the clockwise, you can see there is antiversion, and when you do the anti-clockwise, this is retroversion. This is antiversion and this is retroversion. So antiversion and retroversion can be performed with the help of this grip of the handle. So this is a basically autoclavable uterine manipulator, and this is basically replica, and this is of the Cooper surgical roomy uterine manipulator. In the previous video I have already described you all the expensive disposable uterine manipulators like roomy uterine manipulator or Clermont-Ferrand uterine manipulators. These uterine manipulators are available in the market, but those are more expensive. This is the prototype uterine manipulator which you can use, and it is completely reusable uterine manipulator. So this is the spring type of uterine manipulator where there is a spring which is bringing the antiversion and retroversion of the tip. Now other type of uterine manipulator which is available in the market is the lever type uterine manipulator. It works as a class 1 lever. When you will do antiversion, it will lift the uterus, and when you will retroversion, it will drop the uterus. So this is the lever type of uterine manipulator. Here also you have a three part. This is the tip, and the tip of the uterine manipulator, here also you can change it, and according to the size of uterus you can use a smaller or larger tip. Like suppose you have a large uterus, you can attach it this one, and then you can attach it, and bulky uterus can be attached here. If it is very small uterus, nulliparous uterus, then you can attach the smaller one. Once you buy, they give you the different size and different shape, different type of the tip, and this tip can be attached. So this is the tip of the uterine manipulator, this is the shaft of the uterine manipulator, and this is the handle of the uterine manipulator. This is the handle, and this handle you will hold it to do the different type of movement. This is the handle of the uterine manipulator. Now another, in this lever type of uterine manipulator, you have Tenaculum and colpotomizer. This is colpotomizer. In the market there are different type of colpotomizer. This is called half circle colpotomizer. Half circle colpotomizer is good for the irregular shape of the cervix or cervix, bulky cervix, it is good. and once you will buy it, the company will give you different size of the half circle colpotomizer. Like you can see, this is the small size, this is the large size, and different size of the half circle colpotomizer. And it has a tenaculum. This tenaculum is just to bite the cervix, so that when you will perform the surgery, there should not be any unequal rotation of the uterus. Like if you will not hold by the tenaculum, uterus will be unstable and it can rotate right and left. So this is the tenaculum. When I will open it from below, you can see this tenaculum is opening, and here this is the tenaculum which is opening, and this tenaculum will take a bite over the cervix, and generally anterior and posterior leaf of the cervix should be taken in the bite. To open the tenaculum, here is a screw. This is the screw. Once you will rotate it to the clockwise direction, it will open, and here we can see it is opening. Once you do clockwise direction, tenaculum, it will open, and once you do anti-clockwise direction, this tenaculum is closing, and slowly once you do anti-clock, this tenaculum is closing, and it is completely closed. And when you have to open it, you have to rotate on the tip here on the back, hold the shaft, otherwise entire uterine manipulator will start rotating. So this shaft should be held, and then when you will do it clockwise, then the tenaculum will open. So remember, it is completely different. In the normal scenario, when you should rotate anything clockwise, that should close and anti-clock should open. But here it is reverse. The clockwise will open the tenaculum and anti-clockwise close the tenaculum. So this is, I am rotating anti-clockwise, and you can see tenaculum is closing. So this is how you can use the tenaculum. And this part, once the tenaculum is held, then when you have to do the colpotomy, you keep on rotating it. Like when you want to do the posterior colpotomy, this handle should be at 12 o'clock position, and then this colpotomizer will be at 6 o'clock position. And when you have to do the anterior colpotomy, this handle will go down and this will become at 12 o'clock position. So this is the advantage of this uterine manipulator, and you can keep on rotating and it will work nicely. And when you have to do anteversion, you will drop it down. As a lever action, it will work. So when you have to do anteversion, you will drop down. Patient buttocks must be up to the edge of the table. And when you have to do retroversion, you need to lift it up. So this is the retroversion, this is the anteversion. And once you will do it, it will do the anteversion, and contralateral traction, simply you have to rotate right and left and it will do. And this is here, there is one lever, this is the one flap there. The purpose of this is vaginal seal. So during colpotomy, once the vagina will open, then automatically gas will start leaking. So this colpotomy seal, you have to push it towards, and it should be enter into the vagina so that gas will not leak. And then again you can pull it out once you have to remove the uterus. So this is the half circle colpotomizer. This is good, but it has one problem, that it is not tightly encircling the cervix. So when you use this type of uterine manipulator, your assistant has to keep on rotating this handle. And another problem is that if you have a little carelessness, then there may be the uterosacral ligament will be fully cut. So generally it is preferred to use Clermont-Ferrand type of uterine manipulator. This is the full circle uterine manipulator, and this uterine manipulator was manufactured by the Starch company, and this is called as Clermont-Ferrand uterine manipulator, which is basically invented into the Clermont-Ferrand University in the Germany. So this is very good uterine manipulator, and these uterine manipulators also has full circle as well as half circle. So this is full circle colpotomizer. Once you buy it, they will give you different shape of the tip of the uterine manipulator. Like if it is a nulliparous uterus, you can use a smaller one, the larger one, and very large size also. So how to change the tip? I am opening it here, and this is opened, and here after opening it, you can attach the another small size of the tip of the uterine manipulator, and here you will go simply, you will just attach it and rotate it, it will be fit. Again you can use, it has a small spring also to keep it in the very nice position. And now it is attached. Once it is attached, after that you have the different size of the full circle colpotomizer. Once you will buy it, they will give you various sizes. Like this is for the small uterus, this is 3.5 centimeter size, this is your 2.5 centimeter size, then you have 4 centimeter size, this diameter. And you must use the appropriate diameter of the colpotomizer so that you will be around the cervix, and when you do colpotomy there will not be shortening of the vagina and there will not be injury to the bladder as well as ureter. Because once suppose you have attached it, and if it is a very tight over that, then it will do very nicely. So here we can see that suppose this is the uterus, and you will introduce the tip into the uterus, and it will be tightly. Here we can see this tip is not fitting nicely. The reason could be that this uterus is small for the size of the tip. So you can remove this tip and you can attach the smaller one. So I am just removing it and then attaching the smaller one. And here you will put it like that, and this is the smaller one will be fit. And after that you can see this entire uterus will be nicely fitting here, and then colpotomizer will push it. So this is the important that it should be any uterine manipulator. It is important that the shape must be adequate. Like even if this uterine manipulator if you have, we can see the tip is little larger, so you can change it, and I will use the smaller tip of the uterine manipulator. And here this is the small tip, and I am attaching this small tip here. So once this small tip is attached, now for this size of uterus it will go nicely in, and then this colpotomizer is completely encircling the cervix inside. And when you do colpotomy, only vagina will be cut. There will be no shortening of the vagina, and there will be no injury to the bladder and rectum. So this is the purpose, exactly in the half circle as well as full circle. Suppose I have to use the full circle also, then also exact size of the colpotomizer is necessary. Like this is the full circle, and if I will go like that, then I should attach the exact size of the tip. And now it is attached. After attaching it, we will open the tenaculum. How to open? Already you know, you have to rotate it in the clockwise direction. And when I rotate it in the clockwise, this is the clockwise direction I am rotating. And once you rotate it to clockwise direction, we can see that this tenaculum is opening, and it has an articulation also. Some of them they can articulate, and it can bend according to the anteversion and contralateral traction. And if you want, you can make it straight also. So now it is straightened, and then you will introduce into the cervix. So suppose this is the uterus, it will go completely into the cervix. After entering into the cervix, you will take a bite over the cervix, anterior and posterior leaf, and it is tightly attached. And then you will push it. And once you will push it, this entire full circle of the colpotomizer should take the cervix inside like that. And you will keep on pushing to make it tighter. So if you will see here, this is the beauty that it will not allow to cut the vaginal part of uterosacral ligament, because cervico-vaginal junction will be tented. And once you will cut over the tip of this colpotomizer, then automatically only the small cervico-vaginal junction will cut, and there will be no any shortening of vagina, and it will not take you lateral. And the beauty of this type of uterine manipulator is that you will not have the injury of the vaginal part of uterosacral ligament. So if the vaginal part of uterosacral ligament is not cut, chances of wall prolapse is less. And of course during colpotomy you will push this also. So once you will push it, it will seal the vagina and the gas will not leak. You can rotate it up, down also. You can bring it this ahead and you can bring this one down. So this is how you will use it. And again, once you have your work is done, then you will pull the colpotomizer and open the tenaculum, and after that it will remove the uterus from it will out. So this way you can use half circle as well as full circle colpotomizer. During the procedure of colpotomy, you have to be careful that this handle should be pulled, and handle also give you the little bit rotation. This handle, once you will pull it down, it will do anteversion, and once you will push it up, it will do retroversion. And the pressure should be applied by this handle. The purpose of this handle is that it will give the pressure over the tented vagina. If you will push it by the back, like if you will hold this one to push, there may be perforation of the uterus. So this should not be used to push it. You should always try to push it by the handle. So pushing by the handle has advantage that only colpotomizer will push it, and then the cervix will be pushed by the colpotomizer, not the body of the uterus. So this small precaution should be taken care of. Now other type of uterine manipulator is, this is also called as Marva uterine manipulator or other type of uterine manipulator. This is also very good. In this one there is a tube there, and you can take it out and you will remove it. After that they give you the various sizes of the colpotomizer. This is a small size, this is again medium size, this is little bigger, and this is very big. And you can take any one of them. First you take all of them out, and after that you will introduce this tubing inside, and here you go. And according to the size of uterus, you can decide that which size of the tube will be appropriate. According to the size of the uterus, suppose uterine cavity size is 6 cm, then after 6 cm putting in, you can tight it, and once you will tight it, it will be nicely secured. Now it will not go up or down. And again, if you have to make it little smaller, you rotate it to anti-clockwise direction, and again you can push it in. Very small uterus, you can keep it like this also, and very large uterus, you can bring it back also, and you can tight it. So the tip, you don't have to change it. So in this type of uterine manipulator, you don't have to time change the tip. Just you open it and you can just push it in and push it out to accommodate it. After that, you will take an appropriate size of the colpotomizer. Suppose uterus is very small, nulliparous uterus, then you can use this one and you can attach it like that. If uterus is little large, you can use that one, and that also can be attached over that. You can remove the first one and then you will attach. If uterus is further large, you can attach the extremely large size. And here also similarly, once you will push it, cervix will go inside. But you can see for this size of cervix, this is not good because it is little big. It is not fitting tightly. So you must remove it, and you should use appropriate size. So I hope this is better, and you can attach. This is 3 cm, and then you will see it will be tightly fitting the cervix, and then you can do colpotomy over this. But again the problem is similar, that in this uterine manipulator there is one big problem, that if it is an elongated cervix, it will not fit. In these uterine manipulator, you can see even if the cervix is long, it will fit inside. But in this one elongated cervix, the tenting of the vagina at the cervico-vaginal junction will not happen. Rather, it will create little shortening of the vagina. Another problem of this uterine manipulator is that there is no tenaculum to bite the cervix. So it will be a little unstable, like the round ligament fallopian tube. After cutting the broad ligament, it will start unstable like that, and will start moving it. So this is a big problem of this type of uterine manipulator, which you should keep in mind. Now other type of uterine manipulator is very simple and effective. This is forceps type of uterine manipulator. You will introduce here also similarly, you will introduce it into the uterus. So here, if this is the uterus, you will just introduce into the uterus, and cervix will sit over this tip, and then you will lock it. Once you lock, then inside it opens, and once it opens, it will not come out, and then anteversion and contralateral traction can be given. And when your work is over, then just you open it and then pull the uterine manipulator out. So this forceps site of uterine manipulator is very good for the simple procedure, like the procedure if you want LAVH or ovarian cystectomy or tubal recanalization, you can use it. Here also this is tip, this is shaft, and this is handle, and then you will hold it and you will close it. So this is the different type of uterine manipulator which we have seen right now. So in summary, I will tell you, you have a two type of uterine manipulator. One type is a spring type, where there is a spring. When you rotate it, the clockwise it go anti-version, rotate anti-clockwise, this become retroversion, and then you can rotate right and left for contralateral traction. Another type of uterine manipulator is the lever type, in which this will go in the cervix and this entire body will be outside the vagina, and there is a handle also here. And in this lever type of uterine manipulator, outside when you move down, inside it will go up, outside move up, inside go down, and this will give you very anti-version and contralateral traction. As you know that there are two type of lever type. One is half circle colpotomizer and another is full circle colpotomizer. So in my preference, full circle is better because it keep you more medial and touching the cervix rather than half circle. Another type of uterine manipulator is without colpotomizer, and in which you have the different size of the colpotomizer, but it doesn't have tenaculum to stabilize the cervix, and it doesn't have long colpotomizer, so it is short colpotomizer. And another type of uterine manipulator is forceps type of uterine manipulator, in which once you will close it, it will open, and when you open it will close. So any type of uterine manipulator you can use it, but in my opinion for LFEH you use any type, or for other surgery like ovarian cystectomy, salpingiorectomy you can use any type. But for total laparoscopic hysterectomy, I will prefer you this Clermont-Ferrand type of uterine manipulator, which is marketed by the Stars company, and other companies in India also they are marketing it. And you should use the different tip, different size of the tip, and you should also use the full circle colpotomizer with the tenaculum. So this type of uterine manipulator make it completely good circle of the colpotomy, no vaginal shortening, and there will be no injury to the bladder and rector, and ureteric injury can be minimized, and wall prolapse is less. Wall prolapse is less because the vaginal part of uterosacral will not cut out. So this type of uterine manipulator is much better compared to other. Roomy uterine manipulator is a disposable uterine manipulator that is also very good, but the only problem of roomy uterine manipulator from Cooper Surgical is that it is completely disposable. After one use, half of the portion, it has two balloon, and that balloon has to be completely changed after one surgery. So that's why this uterine manipulator we not use, because reusable type is less expensive and you can use it as long as you want. So thank you very much, and here we have just demonstrated you different type of uterine manipulator and how to use in the cases of the gynae procedure. Thank you very much my friend, and have you a very nice day. God bless you. Thank you.